Hello everyone and welcome to my YouTube channel Colorectal Cancer in Young Adults, which is all about raising awareness regarding the increasing incidence and mortality rates of colorectal cancer in individuals under the age of 50 years old. In this video, I would like to talk about the clinical pathological features of young adults with colorectal cancer compared to those who are diagnosed with this malignancy at the age of 50 years old and above. So clinical features of early onset colorectal cancer differ from late onset colorectal cancer. In young adults with colorectal cancer, we see more patients with the distal colon and rectum. So we divide colon into proximal, distal, and rectum, or right, left, rectum. In late onset colorectal cancer, the frequency of colorectal cancer is almost similar in these three different sites. However, around 70% of young adults with colorectal cancer are diagnosed with the distal and rectum cancer. So the other clinical features of young onset colorectal cancer is we see more young adults with advanced stage of the disease. One study found that young adults are 40% more likely to be diagnosed with stage 3 and stage 4 or advanced stage of the disease compared to their older counterparts. And the tumor biology of young onset colorectal cancer might contribute to this observation. However, there are some patient-based and physician-based factors as well. For example, lack of awareness regarding the increasing incidence and mortality rates of colorectal cancer in young adults, lack of screening among those who are under the age of 45 years old, as well as an under-appreciation of symptoms and delay to seek medical care. All these factors might contribute to the delayed diagnosis and high frequency of advanced stage disease at diagnosis. For example, one study found that young adults have a longer duration of symptoms at presentations and a longer delay in the time to diagnosis, which takes around 7 to 9 months before they get diagnosed with colorectal cancer. The other clinical features of young adults with colorectal cancer is these patients are more likely to be diagnosed with a tumor which has more aggressive histopathological features, for example, signet brain cell carcinoma and mucinous adenocarcinoma. They are also more likely to be diagnosed with synchronous colorectal cancer and metachronous colorectal cancer. So synchronous colorectal cancer is the presence of 2 or more primary colorectal cancer at the same time, or within 6 months after the initial diagnosis. And metachronous colorectal cancer is the development of second primary colorectal cancer in at least 6 months after the first one was diagnosed. So in summary, young onset colorectal cancer is more likely to be diagnosed at advanced stage of the diseases. We see more patients with the rectum and distal colon cancers, and the tumor of these patients has more aggressive histopathological features. And it's very important to raise awareness regarding the increasing incidence of colorectal cancer in individuals under the age of 50 years old.